Welcome back. So today is going to be an interesting one, I can tell already. But before we get into it, let's take a look at the numbers. So we have 314,000 deaths. That's up from yesterday by about 7,000, if memory serves. And then total infected, 4.7 million infected. So continuing to grow. I do not see any real decline in growth there. The numbers fluctuate from day to day, and I think that's to be expected. But that's really, I think, just a matter of collection. Trying to test and collect and then report on this at a global level has to be an exercise that's super difficult. But anyways, let's get on with today, because I got a lot to talk about today, and I think that the sooner I start, the sooner we finish, right? So many of you will disagree with me today. I think that much like some of my other topics that I talk about, many of you could say, well, Rob, yeah, maybe not. And that's fine. I think that, that we should have some healthy debate about this. On my Dr. Erickson videos, I'm sure some people disagreed with me. At least one person in the comments insulted me. And that's fine. I really don't mind. I would hope that we would be able to engage in meaningful debate. I will not insult you no matter what you say, and I just don't believe that's useful, and it's just bad manners as well. So I welcome that. I welcome disagreement. I welcome debate. I welcome discussion, and I really welcome any sort of scientific reference that can show where I've made a mistake and correct me. And I think that's what this is all about, right? Because we're all learning, and I have some opinions, some strong opinions, and I don't hesitate to share those. But I always welcome to be corrected. So there you go. So let's get into it. Just for clarification, I touched my face already, so that's 1 point against me. I should have some sort of demerit system, so that as soon as I touch my face, I have to do 50 push-ups or something like that after every video. Let me know what you think in the comments below. That'd be great. That reminds me, if you like this video, please hit the like button. If you want to be alerted to any new videos, please hit the subscribe button, and that'll help me out a lot. I appreciate that. So, all right, now, I'm tired already. I haven't even started yet. Let's get started. So for clarification, I'm going to be talking about the World Health Organization, but I'm going to refer to it as the WHO, not the TV show or the movie, the WHO, which is cool, but the WHO in this case is going to be the World Health Organization. And also, if I say China or my references make reference to China, I think that that's often a mistake that we're making. And I think what we really mean is the CCP, which is the Chinese Communist Party, the current government there. And I want to really make note of that, because I don't think it's fair just to keep saying China, right? Because there's a lot of people out there, a lot of my friends are Chinese. They live over there. I talk to them every day. There's people here I talk to every day, and they're my close friends. And I think what we're seeing in North America anyway is a little bit of backlash. And this is not their fault, right? They had nothing to do with this. This is really, when we say China, we have to be careful. And I would prefer it if we just switched to saying the CCP, because it's really the government over there that I would say, we have issue with in some cases, right? And I think that's really where this should be directed. I'm touching my face again. For some reason, my face gets super itchy whenever I start doing a live broadcast. It's crazy how many times we touch our face every day. So anyway, I think that's important, right? Many of my close friends are living over there, and that's where I got a lot of this information from originally. So I think that I just want to be really clear on that. And I think we should be careful with our words. The other thing I want to clarify before I get started is I agree there should be some global organization, some global health organization that has our best interests at heart. So I agree there should be an entity, and I believe it should be looking out for us globally. And it shouldn't be partisan to any specific group or country. Like, it should be focused on the global health of everybody. And how do you do that without being biased or without being, whatever, hard? But, at the end of the video, I'll talk about some ideas I have on how we could correct our path going forward. But for now, I just wanted to clarify those points before I get started. And that should reduce some of the conflict that this video might create. Why did I make this video? Because the WHO has a spotted and suspect past at best, and now, based on the research that I've done for this video, I'm really, really surprised they still exist, and surprised that companies or governments give them money and that people donate money to them, because I never would. I would never trust a word they say. I would never give them a cent, because I would like that organization just to go away and get replaced by something that really has our best interests at heart. And there's probably good people that work for the current version of the WHO that can move to the new one. And they've handled this issue terribly, which I will show in this video. And it's very easy to see if you go and just do some research on it. And they are obviously influenced by China, right? So there's two ways this could go. Either they're getting information from China and being told what to report. There's that. I mean, that's possible, right? China gives them a bunch of money, and the U.S. has now stopped. I don't know if they knew that was going to, probably didn't know that was going to happen. But there's that. There's the monetary reward. And there could be other things, right? Like the Thousands Island program or whatever it is that China does, where they get people in compromising positions, and then they will make you do things. But maybe there's that going on. I don't know. For whatever reason, they're the one thing that I see that they could be doing is following the CCP guidelines. Like, go say this, right? The message control. It's either that or they just are dumb, right? Like how would they not know these things, right? So there's either one of the two. They're either incompetent or they're in cahoots with the CCP. Those are the only options that I can think of, you know, because it doesn't make sense to me. Me as a individual, just plain public, you know, citizen, I knew what was going on in December, and it took them till March to declare it a pandemic. And I get it why you'd wait for a little while to declare it a pandemic, but you know, they knew it was. I knew it was transmitting from human to human. I knew that you should wear masks to reduce the chance of infection and the chance it's going to spread. Like, I knew these things. How did I know these things? Because I read the news, and I have friends over there in China that would tell me, hey, Rob, this is going on. This is crazy. And they would tell me what the news was not telling people, the CCP news, right? Which then the WHO was, you know, parroting, blah, 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 right? Which was not helpful for North America or Europe, as we saw. But so how would I know and all these things? And I fortunately was great, because I could go out on Amazon, buy a bunch of masks, buy a bunch of gear that was at a reasonable price, and then the next month or two it started going up. And of course, like 3 months later, you can even buy it. So how was I able to do that, right? That makes no sense to me. So something obviously broken there, right? Okay, let's go through the details. So the latest news, India has backed calls to identify how the SARS virus, that causes COVID-19, was transmitted to animals, to humans, and conduct an impartial evaluation of the World Health Organization's response to the pandemic, according to a draft resolution proposed for the WHO's annual meet beginning this week sometime, I think, right? And a bunch of countries have signed off on that, saying, yep, let's go do that. China, not so much. The CCP, not so much. They haven't signed that. You know, probably some reasons why. And but I'm worried about that, because if the WHO is doing it, like, how good could it be, right? They're going to say, oh yeah, all good here. Like, I have no faith in their ability to deliver a quality product. So, and then the U.S. stopped funding. That happened a few weeks ago or longer. The U.S., I didn't know this, but the U.S. is the biggest funding country of the WHO, with a donation of $3.5 billion over the last decade. So that's a B for billion, right? 3.5 billion over a decade. Where's that money, right? What did the WHO deliver for that? That's what I'd like to see. I mean, the WHO and Tedros is super busy doing tweets all day long, and I think part of that strategy lately has been to bury their bad tweets, which they've deleted. Did I mention that already? They've deleted all the tweets that they did in like January, February, March that were totally wrong, right? For this, the research I was doing for this video, I want to go back and actually get screenshots of their terrible guidance, but they're gone, right? Now, having deleted them doesn't mean that they were wrong, but it does mean something, And at the very least, it means they're probably dreadfully embarrassed by their incompetency, right? And so that was interesting, I think. And that's what really triggered me to go and make this video. So that's that. So 3.5 billion, right? That's a lot of money. And so I'm sure they did some good things. I know that they were working with third world countries on, delivering vaccines and stuff like that. Great. Instead of all your tweets about all the concerts you're going to and all the money you're now getting from other countries and stuff like that, I would start showing that to show the value that you've delivered, because I'm sure you've delivered some value, even though you're corrupt and everything else. But anyway, let's talk the timeline here for a minute, so we can really get into some of the specific details, right? So the general public in China are aware of a highly infectious disease in Wuhan starting in December, right? And I think it's I don't have proof, but I think it was even earlier than that. Sorry, December 2019 that this happens. And I think it was earlier than that. I think it was even like November. People knew, whoa, something bad's going on in Wuhan. But my tracking starts in around December. And I'm just some dude, right? I'm sure that, like, if you were in the intelligence business or something like that, you'd probably have more information. But for me, some dude in Canada knew in December, okay? So I'm touching my face again. What's that, 100 push-ups now? The public announces this through social media. So the public is talking about it in social media in December 2019. I'm alerted. Let's see what's going on. I have purchase history for my receipts. So I actually started buying stuff in December and January. January 5th, 2020, the WHO announces that there is no evidence for human-to-human transmission yet. But this is now rampant in China, right? So they say that, yet the evidence is clear, like on social media and people making videos in Wuhan. So the WHO does not recommend travel advisories or restrictions to China, as China does not want this for some reason, obviously, right? So they're saying, oh, don't worry, everything's good, you can go to China. If we had not listened to them, and some countries didn't, like Taiwan and Hong Kong didn't listen to them, and did remarkably well. Unfortunately, not so much for everybody else. So if we'd stopped travel then, we would be in a totally different place right now. So, but we didn't. Hong Kong health authorities announced as early as January 4th that they suspected human-to-human transmission was already occurring, because it was, right? As they also looked at the evidence on their own contacts in Wuhan. So Taiwan and Hong Kong are very unique for many reasons, right? One, the CCP doesn't like them very much because for political reasons. Two, they're very close to China, right? So they can see very closely what's going on. And three, they know the CCP because they've had experience with SARS and other infectious diseases that have come out of areas like Wuhan. And they know, don't listen to the CCP because they're covering things up. And that's what they've done historically, right? And even the WHO criticized them previously for those outbreaks. And so Taiwan and Hong Kong are pretty tuned in to, okay, well, they're saying that, but that's probably not true. So we need to go wear masks and social distancing and restrictions, right? So that's why they did so well. And if you go do the research, you'll see that. January 12th, the WHO says, again, that there's no clear evidence of human-to-human infection. In reality, though, in China, we now see widespread infection. Residents are concerned that their pets may be infected. So on YouTube, there's disgusting videos of people in China killing their pets because they're worried that it's going to transmit the disease. And so we're past the human to human. We already know the human to human is happening, although the WHO is saying no, it's probably not, right? So crazy, terrible guidance there. All right, January 14th, the WHO now says there's limited human to human infection. What does that mean? Like, limited? So if you have one, you're in big trouble, right? Like I'm not a scientist, so I don't understand it. But like, as soon as you have the first one, you know that you probably have a bunch of others that you don't see. You know that now it's human to human, so it's game on infections, right? Like, hello. So in reality, in China, we now see widespread. Residents are concerned. It's going crazy. They also mentioned that there is a limited human to human infection. What does that mean? Limited? Like I already said that, didn't I? So I don't know how that works. there was two quotes there from the WHO in that time. Um, yeah, so then the WHO tweets that preliminary investigations conducted by the Chinese authorities have found no clear evidence of human-to-human transmission of the novel coronavirus identified in Wuhan, China. So this claim is obviously false. Not now, but even then, it was obviously false. Like we knew, the public knew that this is false, known by authorities in Wuhan to be false. Yet the WHO published this message to the world, therefore reducing the threat level globally. So everybody kind of relaxed, like, "Whew, that's good. It's not a risk. Then we're totally fine." Taiwan had already told the WHO of the truth, right? That this was already spreading. There was infections in Thailand. This was already out of the box, right? The day before that tweet was sent, there was a case in Thailand. A woman from Wuhan had traveled to Thailand and who had never been to the seafood market associated with the outbreak. So strongly suggesting this is spreading outside of Wuhan. Of course it is, right? Of course it is. We know the R naught is high. We know it's highly contagious. And I mean, that's one thing I think we can all agree on, that it's highly contagious. And so they totally missed the boat there. And I think that it's hard for me to accept this as incompetence. This really feels like parroting of the CCP message control, right? January 17th. The WHO does not recommend quarantine or social distancing. What? Like, if we had not listened to them at that point and started to gear up, the world would be a different place today. January 19th, the WHO says there's no clear evidence for sustained human-to-human spread. What? Again, like, I'm not a scientist, but like, you're not containing it. There's zero chance you're going to contain it. And I think that, maybe China was hoping they could, and then they realized, no, we can't contain this. This is like, as soon as you get to like at that point, right, where it starts to explode a little bit locally, there's no chance. There's no chance. But okay, January 21st, the WHO says maybe, and they actually say maybe there is human-to-human spread. What? Maybe? Like, what was that number? 3.5 billion? And you're saying, oh, maybe. The general public now have this for well over a month, right? We know for well over a month that there's human-to-human. And the WHO is saying, well, maybe, right? Maybe we'll have a pandemic. Maybe we'll have the largest number of out of work people in the history of the world. Maybe, 314,000 people will die. Maybe 4.7 million people will be infected. Maybe, oh my God, right? So January 23rd, 2020, the WHO says no evidence of human-to-human spread outside of China, even though this has been documented and submitted to them. So they have proof that this is not true. They have solid evidence that it's outside of China. Of course it is, right? Like, how could it not be? We have flights going on like crazy. Like, how could it, like, again, I'm no scientist, but would that not make sense that if you have flights leaving all the time, and this is highly contagious, that it's possible that it would go outside of China? And even if there's no evidence, right? Do you need evidence to know that that's going to occur? Like, it's just blows my mind. January 27th, the WHO raises the alert level. At this point now, they're realizing, like, okay, we can't delay this anymore. Like, everybody knows, the whole world knows we already have a pandemic. Yet, so there's, let's say something, I guess. January 28th, 28th, the WHO discourages repatriation from China. Why would you do that? Why would you not want to do that, right? The WHO says we have strong confidence for China keeping it under control. Totally wrong, right? Totally wrong. Whatever the motivation to say that was, and it could be one of two things. It can be they're part of the CCP message control, or they're incompetent. Pick one, doesn't matter. Maybe both, probably both, right? I don't know. But no, China doesn't have it under control, and like no country's gonna have it under control. I mean, China, if anybody, with the dictatorship, they just, can break roads, they can put people in jail, they can do all these things, like ultimate control over their population. You'd think that they'd be able to do it. But something like this, like, there's no chance of stopping it, right? It's going to just go through you can't stop the flu. You're not going to stop this. I mean, we don't I mean, yeah, I know we don't try to stop the flu like we do this, but still, like, and maybe they didn't know at first that, well, we can't stop this. But anyway, so totally wrong again. January 30th, the WHO says, till now, we have not seen deaths reported outside China for which China deserves our gratitude and respect. China's transparency is protecting the world. Now, this deserves a medal in stupidity and what's the other word? I don't know. It's just like, really? We're going to thank them for this? I don't think so. I don't think I'm giving us the CCP a medal for this. I really don't. Like, you know, maybe we could sue them for damages, but I'm not going to give them a medal, right? Like, you know, and I say that against the CCP, but I think the WHO is just as responsible for this. So, and then February 3rd, the WHO states there's no need to restrict travel in order to slow the spread of the virus. Thank God people didn't listen to that, and we started restricting travel, because that's the only thing that slowed this down a little bit. I mean, we went from not a pandemic to a pandemic pretty quickly because of the WHO, right? Said, oh, don't worry, just go ahead and travel. Oh, yeah, no. That's what, you know, you move to pandemic level once everybody's infected. And I don't follow the WHO's definition of pandemic. You know, it's nice that they can kind of, you know, rewrite definitions, but it doesn't work that way. So I'm not following that. But still, like, that's how you stop it, right? Is you stop travel for a period. And, you know, it can either be really bad for a long period of time or a short period of time. You get to pick based on your behaviors on a global level. And we've now picked the long term. So March 12th, 2020, the WHO finally declares pandemic. At this point, declaring a pandemic is pointless from the WHO, because we already have, at a global level, the world already knows, yeah, okay, this is a pandemic. We have deaths in every country, or many countries rather, and in Europe it's blowing up, and parts of Asia it's blowing up, and so it's like, why do we even watch the WHO? I don't understand. So, and then they begin blaming countries that don't take immediate action, and they call for aggressive action. Too late. Like, it doesn't work that way. Once the virus has spread so far, right, then aggressive action to do those things that you can do to control it are now, those opportunities are gone, right? So we have to move to this next stage where we're just trying to, like, slow down the curve a little bit. They're still not recommending proper PPE use. So they're still not recommending masks. They're still not reporting the actual details of the virus, such as the R naught and things like that. They're still just bad, like terrible. So that's my timeline so far, right? And I think that it's just terrible. So again, it's either like they're either intentionally misleading us, or they're just stupid and incompetent, right? And I think that when you've got this level of importance with an organization, it really should be quite solid. And there's a lot of smart people out there that were reporting at an individual level, and I got a lot of good reporting from outside of the WHO, and I didn't listen to the WHO. I bought a lot of masks. I have boxes of masks. I have full body suits, a bunch of other stuff, hand sanitizer, all the things that people have needed for the last 3 months. And I was able to get it because I did not listen to the WHO. So, and throughout all of this, the WHO also played that political game with Taiwan, which was very poor taste. Taiwan did a great job of this. They reported a lot of information to the WHO, even though they haven't been able to become a member of it. So, they were one of the countries that advocated the use of masks. Let's see what else here I got. It's so many good things, right, that came out of this. And so that's basically where I want to go with this. So what next? So that's great, Rob. You've outlined a bunch of deficiencies. Yeah, what's next? What's going to come out of this? So basically here, my recommendation would be, okay, until we fix this problem, and I believe we really need to fix this problem, because this is not the last pandemic. Probably in our lifetimes, we're going to have at least a few more. I believe that the growth rate of this will go up. So immediately, what I do is I don't trust the WHO. I don't even listen to them. They're just make-believe to me now. So there's that. I would look for alternate sources of information to guide you in this. And I would use your own judgment as well. I would do things like wear proper PPE when you go out, wear a mask, you know, research how to wear a mask, learn how to wear it properly. Look at other precautions that you can take, like, of course, hand washing. They did manage to get that right. You know, different disinfectants that you can use, and how to treat things you bring into your home, things like that, right? I would do. I would also encourage that we investigate the individuals within the WHO, and prosecute wherever needed, right? People need to be held accountable if they're taking bribes. People need to be held accountable if they're playing political games during this sort of serious global issue. And then I would rebuild the WHO. I would dismantle it. I would remove all the key stakeholders within that organization, and I would build it with new people, and I would build it so that it was protected against any sort of political influence. I would mandate that if you're part of the World Trade Organization, then you need to give money to the WHO, and dictate how much money that is, so that it doesn't fluctuate. And then I would do monthly or yearly audits of the WHO, and really have a watchdog organization that took very careful review of that organization. And I would make the assumption that they're corrupt, because they have been for so long, it appears. And I would try to prove otherwise as that organization existed. So continual pressure, continual audits to make sure they were on the right track. Because I believe that it's too easy for countries to take advantage of organizations like that and corrupt them and use them as a political arm, which is really bad, really terrible for all of us. So that's what I would recommend. But at an individual level, I think that I just would urge you to use good guidance and think about what people are telling you, these different authorities, and for your own safety, just second guess a lot of this stuff, because unfortunately they've, in my opinion, caused us a lot of global issues and made this go on much longer and much more serious than it had to. So yeah, that's it. So let me know what you think. I know I probably upset some of you, and that's fine. If I'm wrong, if you have thoughts around this, let me know. And, you know, I would love some healthy debate on what you think about the World Health Organization and their guidance. Why did they get it so wrong? And what should we do in the future? And if you like these videos, if you want to hear more, if you want to hear me go through the comments and do a second video based on off that, please hit the subscribe button below, and I'd be happy to do that. Okay, that's it. And stay safe out there, all right? See you later.